going for radio and TV broadcasting and ended up being a nurse.
Communication skills are so important in nursing.
Yeah, isn't that funny? But I
I had a girlfriend that did that at Kent.
I love that.
Did communication as a major.
It had to be something with service, you know what I
Yeah.
mean? Yeah, and so.
How far into communications were you until you did a pivot?
It was just well, I actually had pretty much, which I still can't believe it, full scholarship at Michigan, so, but no, Michigan.
Jane, you're good to start. Yep.
All right. We're gonna call the meeting to order. And you wanna do roll call?
Mrs. DiGiacomo,
Here.
Mrs. Mills,
Here.
Ms. Holman, Mr. Timonier,
Here.
Ms. Bell.
I wanna welcome and acknowledge our visitors. And we have a special guest presentation by Elaine Sander, PhD in Maven Lane LLC. And of course, we have Christine Hill here. Ducro. I didn't know if you wanted me to
Health
announce you.
Department.
Of the health, Ashtabula Health Department.
Ashtabula City Health Department.
City Health Department, correct. Okay, so I will let you start.
So I just want to say just a minute about Elaine. So we met Elaine probably about a year and a half ago, and she has been a wonderful addition to our group. She's our consultant. You know, getting this accreditation has been a lot of work, and sometimes you need that third party to take a look at what you've packaged up to submit and say, yep, girls, you hit the mark, or I get 90%, but I think you missed it here. And Elaine's wonderful. She's a great cheerleader. She's a great person to give advice. I think you told us, Elaine, that your background is really communications, and I appreciate that about her. So she was willing to do this presentation for us, and we knew that this committee would probably get a lot out of it, and so we want to thank her. Unfortunately, she lives very far away. She's down in southern Ohio, so doing it virtually seemed to make really good sense, although she was willing to come up, but I said, oh, it's not necessary. And I'm so glad that Jim's got the IT going. Yay. So, anyway, without anything
And the
else,
air conditioning going.
yes, there was no air for a while. So I'll let Elaine take it from here.
Thank you so much. Thank you for the kind words, and to all of council for letting me take some time out of your meeting to present today. And I am going to share a PowerPoint presentation, and I shared earlier that I've emailed this to Chris and Peggy and Ashley. I'm happy to send it to all of you so that you have it for reference later. But one of the things that we really are hoping to accomplish in this presentation and our time together is to pause and really think about community engagement. And all of you are doing this in different ways. I know that you've probably talked a lot about this, but I'm hoping for just a refresher, some rejuvenation and excitement around the idea and some of the techniques of different ways that we can really engage the community in the work that we're doing to make a difference. And so as far as background, I'll keep it very brief. Chris already gave a lovely introduction. My doctorate is in human communication. That was my background. I was a professor for about 13 years, teaching in the classroom about how relationships are built, how groups, teams, and organizations work to accomplish their goals. And my focus area was in health contexts and health communication. And so I had done a lot of consulting work while I was there. And I love our little community down here in Marietta. We're a small town and a mighty one. And I just really appreciated the opportunity to start my own business and do consulting work out in the community to help support the organizations that are trying to accomplish some things I really care about. So thank you for having me. I'm going to give you an opportunity to ask questions at the end. So I'll present for about 15 or 20 minutes. I'll make sure you get to that dinner, Jane. So if I'm going too long, you just cut me off. But I'm going to present, and I'm happy to answer any questions or go in more depth. And I'm also happy to chat with any of you after this presentation as well. I've got my contact information in the slides, and you can reach out at any time if you have follow-up questions. So are we good to go?
Yes.
All right. So I'm going to share the presentation with you, and it should pop up as the main thing that you see, but you should still be able to see me off to the side. Is that correct?
Yes.
Perfect. All right. So as I said, the name of the game today is community engagement. And we throw all kinds of terms around when we're doing work and public service. And I sometimes am not sure if we're all talking about the same thing or just in a similar ballpark. So we're going to do just a little bit of quick definition work. What is a community? And I have a few pictures here. I think we first tend to think of a geographic location, like a neighborhood or Ashtabula city or the county. And those are all true. Those are communities. And then we also know that communities are created by people who have had similar experiences or situations in their life. Groups have been a part of if they're a veteran, if they share a similar cultural heritage, and also interests and hobbies. If you're really into gardening or you're drawn to a certain community in that sense. So communities take a lot of different forms. And when we're talking in the context of public health and public service, community engagement, we're really looking at a process to work collaboratively with and through those groups of people that we talk about as communities. And one of the big things that I want you to take away from this and remember, and I'm 100% guilty of this, is sometimes we work so hard to help our communities and to help other people. But sometimes we forget to actually involve as fully as we can the very people we're wanting to help and improve the well-being of. And so we're just going to take a moment today to look at some different strategies and ways that, you can use community engagement techniques so that then as you're doing your work, you might say, hey, I remember thinking about this, or I've used this before and I had kind of forgotten about it. We want to pull those tools out of the toolbox and continue to use them as we do our work when it makes sense. So the community engagement spectrum, I know that this has a lot on it, and I'm going to just hit a few highlights. Are you able to read the text of this one?
Not at all.
This is kind of the smallest one. So what you're looking at here, if you look on the left-hand side where it has kind of a purple line, it's talking about the level of public participation or participation from the community itself in decision-making, in planning, community development, in policy development, those sorts of things. And so whether you're creating a health promotion plan or a program, or you're looking at improving transportation or housing in your city or whatever it might be, it's talking about how involved is the public or the communities that are affected by these potential decisions. And so that far left, where you see kind of a blue arrow pointing to it, this is no community involvement. There's a 0 on there. It's basically you're ignoring them. And this sounds kind of bad to say. We'd say, oh, no, we wouldn't. We're representatives of the community. We're not ignoring them. But we also like to get things done. And sometimes I can attest that it feels like you can get a heck of a lot more done when you close the door and you can just grind through some ideas or solutions. You think, boy, if I didn't have other people bothering me, I could get stuff done. Well, if we do that too much, we miss out. And so know that I get it. I'm a realist as well. So sometimes we're guilty of these closed door meetings, or we just want to kind of crank through and get stuff done. Now, if we want to ratchet up that involvement, that's what the spectrum is all about, is at each level, we involve the groups affected, or, those communities affected more and more in the work that we're doing or the solutions we're generating. And so that next one up is inform. And the message for this one is we're going to keep you informed. So we're experts in this area. We know a lot about programs. We know a lot about health. Oh, did someone say something?
No.
Good. Okay. And if you get to where you can't hear me very well or anything, just stop me, okay? Don't let me keep going, just holler so I stop. But inform is basically, we're gonna provide information to you. So if you go to an open house, if you have knowledge about a communicable disease that you're sharing, Peggy, or something, like you're gonna give that fact sheet out at the open house, or you're gonna put up billboards, videos, those sorts of things. And this is one we do a lot, and we feel like we this is service that we do to the community. It's important. The next one is consult. So we're ratcheting up again that public involvement for. And here, what do you think we're doing when we say we're going to consult the public?
Yeah, get their
We're going to
input
ask them,
after
we're
that.
going to ask them what they think, right? So, hey, we're working on a solution for this, or we want to put this policy in place. We want to develop this program. What do you think? And so in that fine print, it has examples of the activities you might do here, public comment, focus groups where you sit and talk or interview people, forums, surveys. And I feel like we do these things quite a bit in public service. And so this is the one where you see community engagement the most. But I would argue that this is typically where most of the efforts stop. This is the level that most groups, agencies, committees reach. And it's because we tend to think, oh, it's going to be more efficient if we don't have too many cooks in the kitchen, right? Or we know enough amongst us that we can make some good decisions. A lot of times that's true, but sometimes we are missing a wealth of opportunity, both not only in generating the best solution or opportunities, but we're also missing out on knowledge that we didn't even know was there from the people who are most infected, trust, all sorts of things. So moving up the spectrum, we've only got 3 more. Involve. This is where you bring people in along the way. So you're guiding the process of what you're doing, or if there's an initiative you're trying to push forward in your community, you all are still in charge, but you're inviting people in more. You're saying, hey, we were thinking of gathering information in this way. What do you think? Where do we need to go within the neighborhood or their community? What would be a good approach? So you're involving them more along the process, involving them more in getting feedback on potential avenues you might take, but you're still in the driver's seat. Okay. The next one, your co-pilots. Collaborate. This is where you're both sharing power. So the groups affected, if say you have a certain neighborhood that has issues with sidewalks and streets and active transportation or whatever it may be, collaborate would look different. It wouldn't be going and consulting with them or keeping them informed about the stuff that you're working on. It would be bringing them in from the get-go, or other groups and agencies who are also working, whether they're community groups, or government agencies. And you are really co-partners, pilots, co-learners in the way you go about the whole process. Then that last one, defer to, or sometimes it's labeled empower in the spectrum. This is where you actually give the majority of the power to the public or the group that is most affected. And this can seem really scary, and there can be a lot of red tape to make this level of engagement possible. It's not always the best choice, but sometimes it is what fundamentally transforms communities. So this is where you would see something like community-driven planning and governance, where you would train people in understanding budgets and how different things work within a fiscal year budget and grants, and how you do research in a way that connects with the community. So things where you typically might bring yourselves or other experts in, or you might hire someone like me. I do a lot of research for people because I was heavily trained in different research methods. Instead, you might hire someone like me to come in and train community members who then do it. And they are then the people who are the boots on the ground, who have the ownership, who are going out and making connections to gather information that you need, or to implement changes or communicate about things that are coming up. So my hope from this slide is that you can just start to think about where on the spectrum you tend to operate with a community engagement. And, I know Chris and Peggy have learned from accreditation. They love to see us way up on that empower end, right? And at the very least, collaborate, which is different than how most organizations have operated historically. It's a shift in the way that you approach things. So it's hard, to kind of push that direction. So my message today is I'm not saying you always need to be at that empower end. That's not always what makes sense. That's not always what's going to be most effective or efficient. But for certain things it is, and we'll wrestle with a little bit of where it might make sense to move up from the inform, right, or the consult. Any questions so far?
No.
Good. Okay. All right. So, how many of you are involved in local planning, policy development, resource allocation? In some way, everybody, right? In some way, all of you are contributing. And I threw some things up on the slide that are frequent conversations, as we look at community and economic development, we look at health and well-being. And as you look at this list, you might be able to identify some work or priority area that you've been working in. And I want you to think a little bit about what it would look like if you took a more community engaged approach. And you might be doing it already, right? But recognizing it, naming it, knowing when to pull out what tool is important. But let's say, you recognize that, we had the example of transportation, safe streets, that sort of thing. Here in Marietta, we have a neighborhood within our community that is a high SVI neighborhood. It's a socially vulnerable neighborhood. It has a lower socioeconomic status, has a lot of risk factors, and because not as much tax money comes in, not as much was poured from that community, not as much was poured back into sidewalks and curb cuts and safe crossings and that sort of thing initially. And there were a lot of people who did not have cars because of limited financial means and needed to move with mobility devices or other things to get to places of employment, doctor's offices. Well, people have been working on this challenge and this issue for years and years and years here, right? As you know, it's ongoing. And I remember, sitting in city council meetings and that sort of thing, and it felt for a period of time that it was kind of an us-them thing. Here's the community members, and here's the council. And at the end of the day, everybody wanted to improve the overall well-being for everyone in the community, right? In the best way they can. Everyone had that same end goal. But the way the communication and the relationship unfolded, it didn't always translate that way. And so it became where they really viewed a lot of our agencies and organizations, the community members, as kind of standing in the way of getting what they wanted rather than collaborating with them or working with them. And we shifted that approach. And but I say me, I'm not saying Elaine is some superstar. I'm one little tiny dot here. Tons of wonderful folks from our local health department, from our city council, from a number of groups and agencies, urban development and planning, they all started saying, you know what if we take a different approach and we start really building and educating the residents who have care and concern for their community and want to see a change, and really create avenues for them to educate us better. So not just look at it as we have all of the knowledge, right? Or they don't understand how a budget works or why there are these limitations, but let's shift that power. And we started, you started seeing across pockets the meetings happening in different places within their community and places where they, trusted, and it was a place where they didn't have to come out to something that seemed really superficial or made them nervous in a formal room. The community groups started organizing and doing some of the techniques I'm going to be talking about later, and they had me come and show them some of the ways that they could better articulate and advocate for themselves and collaborate, those tools to collaborate with these other organizations and agencies so that they could accomplish that shared goal. And so again, I did like 1% of this. I'm talking about, collectively getting people to kind of recognize that we can be on the same team and we all have something to share there and some sort of knowledge and expertise that we can pull it forward. And also just reminding people that we have to move forward together. You can get kind of entrenched in things or, how you feel about certain people or processes. So anyway, when you look at different things like this, a lot of times, again, there are opportunities where we can actually still be very efficient, but we can come up with better, more innovative solutions. And some of the proven outcomes of community engagement as we move up that scale and we have greater collaboration with the communities affected by what we're trying to do. We build a lot of trust and commitment. How many of you have felt like you were working so hard for a community and they did not appreciate you? Raise your hand. I've been there, right? Where you're swimming upstream, where you just feel like, oh my goodness, I am trying so hard, and why can't they see that I'm trying so hard here? And they're just making it harder for me to get what we all know that you need. And so building trust and commitment is huge, because then instead of roadblocks, they trust that you're acting in your best interest, and they've been involved and seen the process. It's not been hidden away from them, whether that's a decision or how you've weighed out different options, to follow through with. You gain resources and supporters. We're going to talk here in a moment about the different resources that we can gain from the community, create better communication. You figure out if there are ways that we are never going to reach certain people that we need to reach, if we're using the same standard ways of communicating. Improve overall well-being of the community. We know that when you look at efforts in community change and you look at them, from STEM to STERN and then ongoing, what's been maintained, that the higher the community engagement, the more likely it is that you're actually going to have an impact. You're also more likely to get people who are not one and done, someone who shows up to either complain or help or volunteer for one initiative and then disappears. You don't have as much of that the more you build this, sort of community engaged approach. And finally, you tend to get a lot more innovative solutions. I spent a lot of time in school and on committees and on boards. And then I just remember thinking, we've been so trained to come up with the best solutions, or trained to think that we are the experts, and we do have a lot of expertise, but my goodness, I had sat with a group of kids and a group of teenagers, and we're talking to them about, this healthy food program at school and this bullying prevention program. They came up with better ideas than a room full of us did, for 6 hours. And so recognizing that it can actually speed up that process and we can still share that expertise. One of the things that I want to share, I'm a practical person, we don't have a lot of time, but I want to share a few techniques with you. Again, these are things you may already been using or you may be familiar with, but I'll give you a drive-by right now, and it's a good reminder to use either pieces of them or the whole approach. And then at the end, I have a slide where I put web links in to where you can access toolkits, or if I say, here's an assessment or here's a mapping model, for me, I'm like, oh, that's great, but I'm not going to use it unless I can actually see it. I'm a very visual person, and I like to have, the copies and build upon what's already been done. So I have all of those links for you all to go back and go more in depth if there's something that piques your interest. So we're going to talk about 3 different techniques today. First one is asset mapping, second, collective impact model, and the third is root cause analysis. There's a lot of different forms of that, and that's kind of an old school one. So we'll get into those. So this has a lot of text on it. And the big picture version is basically every neighborhood is filled with resources, passions, and gifts. It's easy to forget that because usually our decision makers are in a room figuring out how to fix our problems. And it's easy to forget all of the assets that we have. So this is an asset-based lens. build momentum or to boost morale in a really important and concrete way by recognizing what resources you actually have in the neighborhood. And these can be associations and organizations, knowledge resources, physical things. We have one small community, a village that's part of our county, and they have 1,200 people. The rates of obesity are really high, unemployment's really high. They need economic stimulation in their community. They looked around and they started gathering, community members who were concerned about the future. And they said, you know what, we have these physical resources. We are right on a river. We have this dock, but it's not very accessible. Our town has these cute shops. It has these restaurants, but we don't make it a destination for people to come. And so here are these resources that we already have, the skills and talents. Sometimes you think, oh, I need someone with research skill or policy skill or that sort of thing. Sometimes you need someone to run a weed eater, and that's their skill or talent, or make a great casserole or be a connector. This group in Beverly, they got together and said, let's clean up this public island that the city hasn't had the money to clean up and make it accessible. We'll get the Boy Scouts. We'll run trash pickup volunteers. We'll start applying for grants to create an actual boat ramp that's accessible for kayakers coming down, so it's a tourist destination. We'll improve signage. We'll, apply for money for a walking path. Well, do you know what it was about $800 in a seed money for this community group ended up being a multi-million-dollar project that'll be done in less than 5 years. So I encourage you to look up Beverly, Ohio, because they looked around in this tiny village and figured out we do have these resources and we can make stuff happen. Asset mapping is another piece of this. So sometimes we need to think not just of formal research methods in the traditional sense, where we think of interviews and surveys and that sort of thing. Those are important. But sometimes informally walking around, if it's a neighborhood that you're looking at improving housing in, if it's whatever it may be, go and informally talk to people, meet with people. Don't be too intrusive, but show people that you care. You want to learn about their interests, strike up a conversation on the corner. Another, a little bit more formal, is a capacity inventory. I've got a link where there's a number of these, but these are a special kind of survey where you can show people in the neighborhood or in the group who may feel that they don't have power, they don't have that voice. Maybe they have a low literacy level, which is something we encounter a lot. Most of the work we're doing, the things that are written, are at a college level, and the average reading level is the 5th grade in the United States. And so a lot of times people think, well, I'm not going to feel comfortable sitting at a table, advocating in that formal way. But capacity surveys can help them recognize their skills and abilities and really transform that person to see how they could be a contributor or a leader, rather than feel like they have to kind of fight in other non-productive ways, a process that they don't understand. They can feel that they understand and have power. A visual map is a wonderful, wonderful, wonderful thing to make of assets or opportunities in a community. This one is from Cincinnati, Ohio. They did workshops and brought people together and had them collectively brainstorm what was unique about each community, each neighborhood, and also then how they could grow that and also share this development money and resources rather than compete against each other for it. And so this was an opportunity to help people look a little bit beyond their pocket of the world and look across to recognize, how you can best use the resources that are available. And help one another out along the way. And there's something really powerful just about something where they feel like everybody knows they can write something down on a paper, right? Or be there and share something and someone can write or draw for them. So making it a little bit less scary for people to be engaged can help bring out some things that we might miss. The next one, this is our second technique, is the collective impact model. And one of the things that you'll find if you have heard of this before, there is a huge nonprofit that does nothing but support collective impact for community organizing and does a lot of work in public service and health. And this model is how do you bring a group of people from different sectors together, residents, people from education, health, government, law enforcement, to a common agenda for solving a problem. So we have so many committed people here in our community working on the same things like food insecurity, transportation, air quality, water quality, and I'm sure you have the same thing, but we don't always row in the same direction, or we aren't always completely aware of what the other person is doing. So if you look at the arrows, the individual collective actions here, these are programs, units, populations, people making efforts to improve the situation. Do they make a difference? Yes. Does it matter? Yes. But man, we are way more powerful when we start rowing in the same direction and coordinating more. The next part here is isolated impacts. So initiatives are working on related issues. They're starting to coordinate some of the pieces, but we're all not shooting necessarily in the same direction. This whole impact model, the whole point is to get to a truly coordinated effort. And the goal here, and when you use this, is that you take a complex problem. It's not going to be fixed in a week or a month or even a year. These are perennial issues that we've dealt with, for a long time. So that's when this type of model is really useful. And you align your efforts. You actually join together with a common agenda. And then everybody is figuring out, how are we going to know if we're making a difference? What kind of shared measurement, what are we going to share with each other to show, what kind of progress we're tracking? Mutually reinforcing activities. This is really important to me. I feel like we all have a puzzle piece. You've seen that image on this presentation. We don't all have to do the same thing, nor should we come at trying to solve these really complex issues in one way, right? We all have a puzzle piece. Some people, for example, like with food insecurity, they're going to be working in the school system because that's their puzzle piece. That's how they're reaching youth and coming up with solutions. Others are going to be working through the food pantries. Others are going to be working through Medicaid. So there's all sorts of different ways. And so mutually reinforcing continuous communication. This model has all kinds of tools and guides for how you can actually keep in touch and know what the other people are doing. And then backbone support. Some folks who step up and say, I'm going to make sure that this doesn't go sideways or it's not like herding cats. I'm going to make sure we keep those arrows pointed in the same direction so that we can really make an impact that makes a difference. And so this model, if you have a real complex issue that's been going on for a long time, this is a great one to use, and they're wonderful tools. You can also sign up to use all of their resources and tools for free. And I can attest, I've used them for a number of years, and they don't bother you. You know how you have to sign up for things and you're like, oh my gosh, I don't want to do this. They don't bother you. You just get access to the different resources and tools, and they just like to know what sector you're working in, because that helps them as they track their impact in sharing these resources free in the community. All right. And the last technique I want to share with you today is related to root cause analysis. And one of the things that we talk a ton about in health is the social determinants of health. So recognizing, we used to think, well, you just tell people it's not healthy, so they're going to stop smoking, or tell people, they need to exercise and they're going to start exercising, and obesity won't be a problem. Well, we realize there are all kinds of reasons why some people may experience poor health outcomes. And we have a lot of really concrete links to those, and recognize that some of the stressors that come about from people who have lower economic stability or low education levels often are connected and tied to poor health outcomes, and sometimes poor health decisions. If you're looking at something like smoking or tobacco use, you could say, oh, well, they just, they should know better because we put out the flyers and they should stop smoking now, right? But we know there are tons of factors. There's family factors. We also know about the health and safety, and is related to the neighborhood you live in, all kinds of things. So this last one, root cause analysis, getting to the bottom of why certain people may be more negatively affected by different things, whether that's in a health outcome or realizing, you know, that a certain population or community within your community really struggles a lot more with housing problems than another one, or really struggles a lot more with maintaining employment. So the 5 whys is an age-old root analysis technique, and I have a link that takes you to a million others. But I love how simple this one is. And it's all about asking why 5 times in a row, or keep going if you need to. If any of you have ever had small children or spent time with them, you'll know that they love this, right? I mean, I remember my kids when they were little, Mommy, why is the sky blue? Why? Why did they, you know, did they walk there? Why is that car red? Why? So it can make you crazy, but you got to keep asking and answering those questions. And here's our theme for the day. Instead of just doing it only in the room with the people who are there right now, what if we bring people in? We're trying to come up with solutions for a community or for a population. Bring them into the why, right? And there's lots of really cool examples, and looking at like mental health and recovery or that sort of thing, where people brought them in, you know, those populations themselves into the why and into the processing. We're like, let's learn together. Here's what we're trying. Why? And then you actually have a chance of getting to the root that is causing the actual outcome. And so we know, for example, when there's more economic stability in a family, in a neighborhood, in a community, that we see lower levels of stress, we see lower levels of negative coping behaviors like, you know, binge drinking, tobacco use, drug use, lower levels of violence, that kind of thing. So the root cause, you know, is not necessarily just, you know, related to the tobacco alone. And there's a quote I love. We're still standing on the bank of the river rescuing people who are drowning. We've not gone to the head of the river to keep them from falling in. And I think that it is easy for me to sit here and say, all right, we got to get to the head of the river on everything, right? We got to prevent everything. I know that's not realistic, but we have to make strides where we can to try to get there, because that's really the only way that we can make that long-term change. So sometimes we design solutions to put a Band-Aid on it or to stop the bleeding. And we have to do that sometimes, right? Or, you know, the programming that we have is to treat people who are maybe already sick, or if someone's already in a bad situation in their family or in their housing or whatever it might be, then we just try to do kind of the quick fix. But we want to always step back and say, okay, is this sustainable? Is this going to actually affect change in a way that moves the bar long term as well? So those were the techniques I had to share with you. And there are links here to a number of different toolkits that I found very helpful in my work. And so again, we'll share these slides to make sure you have that. Contact information is there. And so I'll take questions for whatever time you have now. I know you have a couple other things to take care of, but then any of you are welcome to reach out to me, and I'm happy to chat with you about anything that I've shared today.
I just want to say thank you. You've been a real positive mood booster. Thank you.
Good. Well, that is lovely to hear. I'm happy I could be there for you. Well, I think it's important work, and it's emotionally exhausting work when you care about a community. But, you know, I think it's good when we can rally each other or get a refresh or a restart and share tools and share things that have worked, and also some of those success stories, or have other people to commiserate with when it doesn't go well and say, hey, we tried our best, but we need to try something different. So where we can build our community to do that, it makes life better.
Thank you.
Thanks, Elaine. That was wonderful. It's just a reminder about some of those techniques, and you know, you're very realistic. You're very good about saying, you know, this isn't always something you can do, but keep this in mind. And I appreciate the links, and we'll share all of that with the committee. And you know, we just really appreciate you coming and presenting. And I don't know if you could
Absolutely.
see it, but the heads were nodding as you were talking. Nodding.
Well, good. Well, I hope it was somewhat helpful, and I'm happy to answer any questions you have. But if you need to move on to other things, again, I really mean it. Don't hesitate to reach out, and I really appreciate you having me in for the presentation.
Thank you.
Thank you for presenting.
All right, moving along.
Is that
Thank
okay?
you. Yeah,
Thank
no,
you.
that was
Thank you
so
very,
good.
very much for letting her present.
And we can reach out to her if
Yeah,
we're working on
she's
something.
got an
and-
email.
I will be reaching out to you, thank you.
Yeah.
Yeah, she's wonderful, so, thanks, guys, appreciate it. I know you
Thank you, Peggy.
get out of the way so you can finish your business and get home to dinner.
Okay, for Parks and Rec, I don't see anyone here tonight, but I do see that their next meeting is June 4th at Smithfield. So that is open to the public. And is there a city manager's report?
No, not really. I mean, I can just touch on a couple things. Obviously, we're still watching a lot of the projects that are going on through completion. As most of you know, coming up here in June, the hospital will be opening up their wing. So that's exciting. Although we talked about it last year as the DG Market was being built, most of you all can see that as they said they were going to do, and as I said they were going to do, the landscaping, the grass has been planted, and sidewalks were done. That was all included in the project. Just don't want to pour those in December and January, as most people should know. But those have all been pretty much completed. They also did do some new curbing along Park Avenue in sections of Main Avenue as well. So glad to see that's done. We all went to the opening of the Chestnut Village. I can't remember if we've had a meeting since then or not. It's kind of in the move of moving City Hall and everything. And probably the most notable is the grant award that we did get for the Appalachian Community Grant. We still have not heard exactly what the $1.6 million is going to fund. We have been in contact with not only the county land bank, but with Eastgate to try to figure that out. As soon as we have all that information flowing, we will pass it along. We'll probably do a debrief or some type of outreach meeting with the downtown, probably both the ADDA and whoever's not part of ADDA that has a building down here, so that everybody can be on the same page and know what to expect. It'll be a very, very tight timeline. But I do think that we had between 32 and 35 respondents for the facade program. That's probably I'm 90% sure that was funded. Because that was a big deal. We were really pushing for that throughout the entire county. So making sure everybody's on board with that, has the funds available. We have some other organizations that want to participate in that as well, to make sure that funds are available to the business owners and building owners to do some facade improvement down here.
So with that, just help me remember, if I remember correctly, so if I am a business owner and I'm paying up front, so they would be.
So those are all the details that we have not heard yet.
I got it.
We, when we did this program down in the harbor, it was a 50% match. We wrote it for more grant money and less out of pocket this time. We don't know what those percentages have come to.
I got
So
you.
there's a lot of I mean, it was nice to have the announcement, but it just left a lot more questions.
I got you.
And those are the things that we're trying to get through. So we'll do, fact sheets. We'll bring everybody in once we get all that arranged, and then we'll hopefully have people on board to help walk everybody through that process so nobody misses anything.
Can I ask what's the timeline for completion?
Quick, because this is Appalachian regional money,
Yeah.
and it came through ARPA. I want to say everything has to be spent in early 2025, which, with our construction season here, and one of the things that we built into ours was sidewalks and streetscape. That leaves very little time to get that construction work done. From the time we have to engineer it, bid it, and then get the contractor on board to do the work. So, yeah, it's gonna be tight.
All right. So I had a new business about tax abatement. That was Ms. Holman that wanted to discuss that. And as I think back to our last council meeting, I thought she said she wasn't going to be at June meeting, but she must have meant this meeting. So we'll just move that to a different meeting.
Can I ask one question?
Sure.
Any updates on the playground equipment at Walnut? Because I know that's a timeline.
Yeah, that one's
too.
a very, very big crunch. So we are working with some of the playground companies. We have an MOU drafted with Board of DD. They're reviewing it right now. So the big steps is we got to get that MOU signed and completed, brought to council, and then we can start making commitments with these companies for the
Okay.
funds. Yeah.
Yeah, that's
But we do have a company that's on board doing some drawings and stuff for us now. We did do a field trip to 2 different inclusive playgrounds in the Youngstown area. They were wonderful to see. One was over $3 million. Obviously, we don't have that to work with, but very, very cool to see. And we got some good feedback of, yes, this equipment works, or we would have done this differently. And then they had a conference in Columbus and stopped, I think, at 2 or 3 on the way down to see. So getting some good ideas, and then of course the companies themselves are helping us design.
So I do have, not to jump back to Parks and Rec, Margaret Disler, her term is up and she is going to not renew for that, so we will have an opening on that. So I don't know if that is something that,
Council's appointment.
yeah, it is council's appointment. So maybe you'll be able to bring that up at the council meeting. All right, does anyone else have anything they want to add, say? No?
I'm gonna try to make it to the Park and Rec meeting.
I unfortunately can't because I'm going to be gone out of town, but that would be awesome. All right, we are adjourned.